This is DGMT's Learning Lunch, and I'm your host, Rahima Esop. Today we are diving into a crucial topic, the role of NPOs in providing social welfare services to marginalised and vulnerable people, especially in the face of national government budget cuts. Let's start with a typical scenario to set the stage. So, imagine a small non-profit that runs a place of safety for orphaned or abandoned children. They provide shelter, food, stimulation, safety, and emotional support. This NPO relies heavily on donations, donor funding, and government support to sustain its operations and fulfill its mission of giving these children a chance at a better life. However, due to budget cuts at the national and provincial levels, their funding has been reduced significantly. At the same time, we also know that donor funding from the private sector is dependent on the donor's corporate social responsibility strategy, whether it views the project as sustainable and other considerations. Joining me to talk about this is Nasipi Zwakala, an innovation manager at DGMT, who focuses on grants of compassion and care. Nasipi, thank you for joining me here today. It's so nice to have you.
Thank you for having me, Raima.
Nasipi, let's start by getting everyone on the same page about what we mean when we use the term social welfare and the type of organizations that typically provide these services and the people that they serve.
The term social welfare is quite broad and refers to a range of support services and support systems that are put in place to improve the well-being and quality of life of individuals and communities. So these services vary in addressing social, economic, and health needs, particularly focusing on vulnerable and disadvantaged groups. So in the South African context, the organization typically look like the government departments providing the services, non-governmental organizations, community-based organizations, and the faith-based sector, which also has a strong history in providing social welfare. And when we're looking at the services that are provided, we think of social assistance programs that offer mental health support, which is the psychosocial, programs that are looking at the child welfare and looking at youth welfare, programs that support senior citizens and even food security. So all in all, social welfare, it's about creating inclusive services that are focusing on marginalized and vulnerable members of our society. And these are the children. These are our senior citizens. These are people living with disabilities, and these are people living in poverty. So these focus areas, some of the focal areas of grants of compassion and care, and they work in tandem with the DSD services as well. And today, we are going to be focusing on NGOs as the primary provider of the services.
For the benefit of our listeners, DSD is the Department of Social Development. And yes, absolutely, it's really useful to provide a big picture overview of the various entities that provide these services. But we are zooming in on NGOs who have been subjected to budget cuts. Where do NGOs in particular get their funding from besides the public sector?
NGOs are funded through a combination of funding sources, and how that looks like is getting funding from international aid, getting funding from private donations, grants, and philanthropic organizations such as DGMT. When we think of international aid, we think of organizations like the United Nations agencies, the World Bank. They've done a lot of work in South Africa in supporting these organizations. And in terms of private donations, let's think of corporate social investment, which is becoming a huge role player in the NGO sector and is actually one of the biggest donors. Research shows that corporate social investment is becoming one of the biggest role players in the sector, along with the philanthropic sector. And organizations are also innovating, tapping into the global space, connecting to crowdfunding sources, innovating with their social media campaigns to broaden the reach of their funding. So these are the different ways and different sources.
Nasibi, correct me if I'm wrong. I guess they are adapting to an environment where the pool of funds from the public sector is becoming smaller and smaller. With the recent budget cuts at the national level and at the provincial level, what impact have you observed on these NGOs, particularly in terms of their ability to deliver services effectively?
The Gauteng Care Crisis Committee shows some of the impact that the cuts have on organizations, and it is disheartening to see. Some services have been reduced, and it could also mean retrenchments for some of the staff members, could also mean salary reductions. But the challenge with that is that the demand on these organizations does not reduce because the services are needed by the communities. And the consequences of these budget cuts can become more apparent over time.
Nasibi, let's pause for a moment because we asked a NPO to tell us about how it's affected by the recent budget cuts.
My name is Leona Pinor. I'm the CEO for MES Empower Serve. The impact we've experienced due to the cut in subsidies or the late payments has been that we had to start consultation with staff in terms of retrenchments. We also had to secure bridging finance in the form of a loan from our Sustainability Trust, and we had to plead for additional donations in terms of goods in kind just to help us keep our doors open during this uncertain period.
Nasibi, give me a sense of where we are seeing the greatest impact of reduced funding. Which province is the worst affected, or which provinces are the worst affected in your experience?
This is a bit tricky, but the impact depends on provincial allocations as well as service specifications. But I have seen Gauteng is one of the most impacted with the budget cuts.
I'm glad you said that because Gauteng for me was top of mind, given the number of media reports that I've seen recently that speak about the impact of these budget cuts in that particular province. But I'm sure there are others.
Yes, definitely. There are others. There have been publications, for example, in KZN, outlining the decline of funding as well. There have been reports in the Western Cape as well. 53 million rands less than the last financial year. So there are other provinces who are also impacted by the cuts.
Clearly, as you so rightly pointed out in the beginning, these organizations are filling a gap in the provision of services to some of the most vulnerable children and adults in our society. And that is generating value for the communities and for society as a whole. I think it's worth teasing out what counts as value and how should we be thinking about value in this context.
I have one quote that I think encapsulates this. A wounded child battles to learn. A person who feels degraded and unloved struggles to give themselves to others. Process of care and healing must be embedded in our work. And when I say our work, I say the work of the sector. And I think this quote encapsulates the value of the work. And this value is creating an enabling environment for human development. through inclusive access to social services. It is catalyzing a twist out of an unequal society. And that's the value.
Now, CP, you are preaching to the choir here, because I've recently had interactions with social welfare services or the care sector in dealing with a place of safety. I've recently adopted a son who was staying at a place of safety. He was in a space where he was receiving good nutrition and stimulation and care and was looked after. Unless you have an interaction with the sector, if you are from a privileged background, perhaps you don't interact with the sector, that value is not apparent, that it's not obvious.
This is a tough one, Rahima. I think there is definitely room to improve. There are also efforts that are being made to recognize the value these organizations bring to our society. DGMT has been working with the DSD and National Treasury to develop a sector funding policy, which is aimed at improving efficiencies and effectiveness of the sector. So I believe there's still more that can be done, but slowly but surely we are coming into a space where the voices, are being listened to, and there is a shift in the sector from a more welfarist approach to a more holistic approach in looking at the value of social welfare.
Given these challenges, what strategies do you believe NGOs can adopt to mitigate the impact of these budget cuts, which are a reality, to be able to continue providing essential services to those who need it?
Firstly, one must recognize the challenging context in which NGOs function in, which impacts the capacity to implement adaptive strategies. This requires time and funds in already strained circumstances. And so I have to put a disclaimer before answering. This is not an antidote, but some of these strategies can be implemented where there's contextual significance. These include diversification of funding sources, focusing on core programs, and then advocacy, which is even currently playing quite a crucial role. And I think one that I'm seeing more often these days is the collaboration and networking between organizations. So organizations can leverage on each other's skill sets and resources to also reduce the costs of developing new programs.
Okay, I want to zoom in on each of those. Let's start with the diversification of funds, right? Say I'm an NGO and I know that I need different income streams. How do I go about identifying A, where these income streams are going to come from, B, how do I pitch, apply for grants, C, do I have all of my paperwork in place? It seems daunting. So it's easy to say diversification of funds, but when you get down to it, it's quite a process. If you could just run me through what NGOs need to consider when thinking about diversifying their funding.
This is where the power of collaboration comes into play, Rahima. Because when we are in silos, it's not easy to get information. It's not easy to learn from other organizations in the sector. So by plugging yourself into a community where you have access to best practice, you have access to resources, you broaden your scope to have access to alternative funding means, to know when to apply, how to apply, what are the key things that I need as an organization to have a successful application. But it is complex. It's a complex process. I cannot undermine that, especially for organizations that find themselves in more remote areas and in areas with limited internet connectivities. But I do think it starts with connecting to others.
Put differently, it's about having the right people in your WhatsApp group that you can rely on to get information and ask questions and share resources. So the other point that I want to just zoom into that you mentioned is about identifying what your core services are. Can you give us some detail about how one would go about doing that?
It starts with identifying what your strength is as an organization. And then once you've identified the strengths, identify your weaknesses so you can leverage other organizations in providing those services through referrals. And also strategy in intentionally looking at what has been working over time. And I think that helps you get closer to the answer of what your core focus should be.
I guess, Nasipi, that would help in making one's operations leaner and less capital intensive. Nasipi, what else can organizations do to optimize their operations?
It is a process of constantly learning from experience, current operations, and forecasting change. Monitoring and evaluation helps to paint that picture of what is doing well and what's not doing well. That informs planning, which then in turn optimizes operations.
Okay, Nasipi, so we mentioned strategies that NPOs can deploy, but where do they get training or resources to be able to be capacitated to make these changes? What's available to them?
It is not simply about receiving resources, Raima. It is about journeying with organizations that provide training and organizational strengthening, focusing on financial management, governance, and other strategic areas. This journey can take a long time, and it does not happen overnight. And that is why there are specific organizations that focus on providing this service. And they are funded by donors who recognize that there's a need in the sector. Organizations that come to mind: the Social Change Assistance Trust and RDSP, Rural Development Support Program. Amongst other services, legal services from organizations like Pro Bono, and even access to crowdfunding platforms like GiveGain, BackerBuddy. These are just a few of those examples.
Thanks, Nasipi. I think that's very useful to think about it as a journey and not something that can happen overnight. The training that is required to get NPOs to a position where they are able to leverage private donor funding because their finances are in order, their governance structures are in order, and their programmatic work is in order. What is DGMT's commitment to the sector and our message to other donors and civil society organizations?
We have a commitment to supporting organizations through strategic investments, through the 10 opportunities and grants of compassion and care, building the necessary connections and supporting civil society with the available resources. It can be challenging, but it is rooted in compassion and care for the most marginalized and vulnerable in our society. And the call to other donors and civil society is to collaborate our efforts towards a better society.
Absolutely, and valuing this hidden K economy whose services are so crucial to human development, to enabling human development, as you put it earlier. Thank you, Nasipi, for sharing your insights and your expertise and experience. It's clear that NGOs play a vital role in our society, and it's crucial to ensure they have the support and resources they need to continue making a positive impact on the lives of vulnerable and marginalized individuals. And now, over to you, those listening to the podcast. Using what you have heard today, you can try this reflective exercise. You'll need a pen and a paper to write down these steps, or download the takeaway sheet from dgmt.co.za. Remember to go to the podcast page. Write down the following questions and spend some time reflecting on them by yourself, and then share your reflections with your colleagues. Question number 1. What is your organization's story about creating value in your community? Question number 2. How are you telling this story currently? And question number 3. Start by thinking of 6 words that best describe how you are contributing to positive social, economic, and public health outcomes. Now use these words to craft your new story of value. This is DGMT's Learning Lunch. Until next time.